Hello guys, this is Dr. Possibility from Excel Academy. In this tutorial, I'm just going to explain my part 11 of my histology revision. And in this tutorial, I am much focused on identifying the slides and the location. Let's quickly get started. So the first slide we have been given is label the part shown by the arrow. And this part is just the osteocyte. Then state the function of that part shown by the arrow. And the function is just to maintain and monitor mineral and protein content in the matrix. Let's quickly go to the next slide. The next slide, we have been asked to identify the slide. And this slide is just the pseudo stratified columnar epithelium which is ciliated. Then state the location. The location you can give is just the trachea or any part of the respiratory tract. And then the next slide, we have been asked to identify this slide, and this slide is just the transitional epithelium. And then if you are asked to state the location you can give is the urinary bladder. Let's quickly move on and look at the next slide. We have been asked to identify the slide. More specifically, we have been asked to state the part with the arrow. And the part with the arrow are just the simple squamous epithelium. State the location. The location can be the blood vessels and also along the Bowman capsule of the kidney. Remember that the Bowman capsule of the kidney has the endothelial cells. Let's quickly move on and look at the next slide. The next slide we have been asked is to identify the slide. So this slide, it is just the adipose tissue. If you look at the nucleus where they are on the peripheral side. Then state the function, state the location. The location can be under the skin, around the kidney, and also around many oral organs. Then we have been given this other slide, which is identify the slide, and this is just the dense regular connective tissue. State the location, you can give the tendon and also the ligament. The next question is, the next slide we have been given is this slide, which is identify the slide. So the answer here is just the dense irregular connective tissue. State the location, it can be the dermis of the skin and also in the submucosa of digestive tract. Let's quickly move on and look at the next slide. Identify the slide. So if you look at this slide, this is just the hyaline cartilage. State the location. You can pick the trachea. You can also pick the larynx. Let's quickly move on and look at the next one. The next one is the elastic cartilage. Location, you can pick the external acoustic meters and also the larynx if you want to add more. The next one is this slide, which is just the smooth muscles, and then the location at the walls of blood vessels, stomach, and small intestine. Thank you very much guys for joining me. This was Dr. Possibility from Excel Academy. Please make sure that you subscribe and register with us.